So now for the second part of the examination for the case study clinical finding, uh, which is the left ilium stuck in anterior rotation. So to start off with my patient that has the left ilium stuck in anterior rotation, I'll be the first technique I'll be doing is the MET hold relax technique for anterior rotation. So using basically using the hamstring. So the reason I decided to start off with this technique is because basically the indication for it is for ASIS that's lower compared to the other one, to the one on the other side, and the PSIS higher than the other PSIS on the other side, and just in general for an ilium that's stuck in anterior rotation, which just so happens to be the case here. So I figured start off with a technique that actually targets the main problem. Also, this will allow for the hip flexors and extensors to be activated and warmed up, which is needed because we want because when both these groups of muscles are properly activated and synchronized, this will make it easier to do certain exercise and stretches that are specific for those muscle groups or that require those muscle groups a lot. So now onto it. So my patient here is lying prone. They're gonna have their affected leg hanging off the table or the bed. One hand is gonna be on the sacral sulcus, so just look for it here. Got it. And the other hand is above the knee. Okay. And then the patient's foot is going to be supported on my thigh. So now what I'm going to be doing is I'm going to be moving the hip passively to flexion until I feel a barrier, which is at around this point here. And now what I'm going to ask my patient to do is to contract and extend their leg towards my thigh. So I'll do that for 6 seconds. 1, 2, 3, 4, 5, 6. Relax. Bring them into further range so I feel the barrier. Perfect. Now I ask my patient to contract into my thigh again, into extension. Perfect. Now 6 seconds have passed. Relax. And I would bring my patient's hips into further flexion. So ideally, this would be done 3 to 5 times. So yeah, that's it. Now on to the other techniques. Okay, so we started off with the manual technique of the MET for the hold relax of the anterior rotation of the ilium. So next will be the stretch, which I decide to prescribe the lunge position static stretch. So basically I chose this so that we could stretch out the hip flexors, since most likely if the ilium is rotated anteriorly, it's because you have certain hip flexor muscles like the iliopsoas and especially the rectus femoris, which is probably pulling down on the bone. So that's why we wanna stretch them out so that we're reducing their pulling capacity. So since it's on the left side, I would have the right leg in the bent position so that the hip flexors here are on a stretch, making sure the patient is doing it with a proper posture, so lifting themselves up like a puppet, a slight chin tuck and TVA activation. It's bringing their belly button towards their spine, and they maintain that position like so. And yeah, so I would advise the patient to do that uh, for 3 sets of 20 seconds. Uh, Third thing is going to be the doing posterior pelvic tilts on a Swiss ball. So the reason I decided to prescribe this is because we want to encourage the ilium to go backwards into neutral position, and yeah, so backwards into neutral position. Uh, so that's why I decided to choose that as my range of motion exercises, range of motion exercise. Uh, and we want to use a repetitive technique so that it's encouraging the the pelvis to move back into neutral. Also, the reason I decided to choose my range of motion exercise third, so more towards the later stages, is because I wanted to make sure all the muscles are properly warmed up and stretched out, so that the patient could do this range of motion exercise with more end range, so making it more effective. So since I don't have a Swiss ball, I'll be showing the exercise with a soccer ball on the stool, just to basically demonstrate the idea and just to understand the technique. So basically the patient would be seated on the ball, uh, adjusting their posture, so lifting themselves up like a puppet, proper chin tuck, uh, activating the core, especially the TVA, adjusting the pelvis so that it's in a neutral position, and then they would go back so that the pelvis is doing a posterior pelvic tilt. And if they want to be sure it's doing so, they could place their hands around their pelvis. So with regards to parameters, I would advise the patient would do that for 3 sets of 20 reps. May seem like a lot, but like I said, we want to implement a lot of repetition to be sure that the pelvis is being brought back into neutral. Last, I'll be demonstrating my strengthening exercise, which are the hip thrusts. So the reason I decided to choose the hip thrusts as my strengthening exercise is because with the ilium rotated in an anterior position, it's most likely putting certain muscle groups like the hamstring and the glutes in a lengthened position. So by doing hip thrusts, we'll be activating the glutes and hamstrings. So activating them will make them contract, hopefully, well, by allowing them to be activated and contract, it'll pull on the ilium backwards. So hopefully, eventually putting it back into neutral position. Also, the reason I decided to choose this for my last technique or exercise is because we want to, in this case, I want to keep the strengthening exercise for the end, because we want to avoid doing it at the beginning, or else we just end up fatiguing the muscles, and as well stressing out surrounding connective tissue early on in the session, making it harder to do other like techniques, stretches, or exercises later in the session. And also, we want to make sure the patient is properly warmed up and have done all their stretches, so that when they're doing this exercise, they're doing it with more end range, making the exercise more effective. So for the hip thrust, patient is going to be supine on the floor. Again, making sure they have the proper pelvic tilt. Make sure they have a bit of a chin tuck happening, and proper core activation, especially the TVA. Hands on the sides, and they thrust their hips. Keeping it in the air 1 to 2 seconds. And that's how you do it for that. And with regards to parameters, I would advise the patient to do it 3 sets of 12 reps.